Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to show something you can do that makes the facial structure look so much better. And this person had a TMJ problem, and we learned how to do that by advancing the mandibles to get rid of the TMJ problem, and the person looked so much better. So now we were taking people and advancing their mandible to some extent, and it doesn't seem to bother the temporomandibular joint at all. And we don't make the jaw grow longer, we just kind of angle the condyle back, and then we increase the gonal angle down here, and it'll bring the jaw in a forward direction. I'm going to run through that and show it to you as close as we can do it. Back here, we'll try to show that. Here is the lady when we started out, and this is the way she looked with her lower jaw was back like that. We advanced, and these are the same woman now. And look at this, that much difference in the face. And you bring it out there, and as long as you keep it out there, it'll finally grow in that direction. But if you go back and forth, it never will get there, but you can bring it out, and it'll hold the jaw out in that direction. The gonal angle changes, and the head of the condyle moves back. That brings the jaw out. And so watch that take place. There's where she was. We started in 1985, and then here it is where you see the class 2 problem she had like that, and then we brought it out to that point. Now some of this is leaning a little too much like that, but if you hold it there over a long period of time, and this was 1984, and here it is 1987. I'm going to run through this because she had a tongue thrust too, and we put a deal on there to break her tongue thrust problem there. And we used a headgear to bring those teeth back to some extent. And we'll just watch it change now. We've got it out that far. And here she is in 1988. The jaw fitting out like that. And that's a class 1 relation. Now watch this. We're going to move the lower jaw out, and you'll see this dot down in that little opening right there. She had a bridge back here, and we just used the bridge and brought it forward with the rest of the stuff. The condyles, you could see, they brought them out and they held them there, and they moved back. In other words, the neck of the condyle changed. I'm sorry to run through this, but I don't have much time to show this. You don't have to pay much attention to this. But the models were like that when we started in 84. And here it is in 90. It went from that point to this point. It's in January of 90. And watch this lower jaw, we brought it out, brought the upper back some. Now hold it out there pretty good. At that point, it's a little bit gone back, but not far. She had to have one of the teeth re-crowned there. Now that's forward long. That's a kind of a serious looking facial structure. That's 90. Jaw is back as far as you would get it, and that's as far you go back. And I carried this lady and another lady to the dental society and showed them how we had advanced the mandible here without doing any surgery or anything. And then we brought it out like that. And here's her smile. She still had a night retainer with a big ramp and a day retainer with a very small ramp on it to keep it that way. You bring the jaw out there, you keep it there, and it looks so much better. They like it out there, and so they tend to hold it, and the whole thing changes to fit at that point. There's the night and the day retainer. So here she is in 93 as a night retainer, a day retainer, 93. There's her. I don't like those removable retainers, but you can use those to some extent. Here's in 93. That's her facial structure, 93. 97, here it is again. That may be the last. Those cuspids down in the right place, 97. And I think we lost contact with her. Oh, here we are, 2000. It's 2003. We had to go back and kind of encourage her to wear this out during this time, 2003. All right, this is how the lady got old looking. She gained a little weight, but the face is there, 2003. So this is something people can do, and that's 1985, and here goes 03, 85. So it's held up all this time, and that's the way the facial structure looks. So we advanced the mandible, got rid of the TMJ problem, and solved the facial structure problem. Thank you for watching, and I'm going to sign out now, and we'll pick up again next week.